Hi, I'm Dr. Deborah Mulligan. I'm a board-certified pediatric and emergency medicine physician and professor at Nova Southeastern University Kiran C. Patel College of Osteopathic Medicine. And I'm here today with you and the National Hispanic Medical Association. Today, we're going to look at how influenza is an example of medical myths potentially interfering with good medical care. And I'm going to talk to you about the top 10 I hear most from my patients regarding influenza. So we'll go each one by one. First, it's no big deal to get the flu. It's just a cold. Not exactly. There are some symptoms that are similar, like fever, sore throat, runny nose, cough. However, they're not at all the same. Influenza can carry much more complications and be of greater harm to you than an ordinary common cold. In fact, last year, the Center for Disease Control tells us that there were 410,000 hospitalizations, 24,000 deaths, and 18 million visits for influenza. It's important to prevent yourself from falling ill from that virus. 2, you can't spread the flu if you're feeling well. Well, that's not so. Of the people tested, 20 to 30% of persons with no symptoms at all tested positive for influenza. And so yes, you can pass that along without realizing it to your family, friends, employees. And so you do want to make sure that you're protecting yourself and others by getting vaccinated, washing your hands, being careful about how you sneeze and cough if you do have symptoms. 3, you don't need to get a flu shot every year. Oh, yes, you do. Influenza is a virus. It's trying to survive. So every year it modifies itself. It changes. And so each year we look at the strain that's most likely to cause illness, and the researchers create a vaccine against that strain. Now, it's true that not everybody gets protected 100% of the time. However, if you get the vaccine and you do fall ill, your symptoms are far less likely to be severe. And so it's still worth the benefit of getting the vaccination. We're headed into a long winter, and so you have time to get your vaccines now. 4, the flu vaccine can give you the flu. No, it doesn't. The flu vaccine may cause some side effects that seem like the flu. Those are pretty common, like maybe a low-grade fever, maybe a little redness at the site of the shot, maybe some body aches. But that is not the flu. That's really just showing you that the vaccine revved up your immune system. And some people think that subsequent to getting the vaccine, they fell ill. Well, it could be you just happened to pick up a virus along the way, coincidentally, around that same time. Do remember it takes up to 2 weeks for the vaccine to be fully effective from the date of the shot or the nasal spray. So let's see, we're up to number 5. You can catch the flu from going in cold weather without a coat, with wet hair, or sitting near a drafty window or door. It's just coincidental. Remember, influenza is in the winter, and so it is cold outside. And it doesn't really have any direct cause or effect from maybe not wearing your coat completely correct, maybe your hair was a little wet, maybe you sat near a drafty door. There is no connection to catching the flu. The only way you get the flu is being exposed to someone sick with the flu. Let's see, 6, feed a cold, starve a fever. If you have a fever, you need to drink. You need to increase your fluid intake. It's very important. And you may not be that hungry because of the illness. Maybe your appetite's down, but you really need to increase good nutrients in your body. So you do have to eat as best you can healthy foods. 7, chicken soup will speed up your recovery from the flu. That is true to some degree. When we make chicken soup, we're including different kinds of herbs that we'll mention in a moment. Chicken soup helps you in a lot of ways. One is the warmth, the heat soothes your throat. The steam from the soup thins out the mucus in your nose and helps it drain. And there are some anti-inflammatory properties to chicken soup that help with your symptoms. The same goes for tea. Black tea, green tea have flavonoids in them, and the flavonoids are antioxidants which help with your symptoms and make you feel better. As well, the steam again and the warmth for your sore throat. And then herbs. Well, maybe you're not so hungry. Mint will increase your appetite, and then herbs like oregano, sage, some other herbs will be very helpful in your symptoms. They also have some anti-inflammatory type benefits to them. And then lastly, my grandmother, I don't know about yours, but mine used to say we should wear garlic around our neck. Maybe that worked because people don't want to come near you if you're wearing a string of garlic around your neck. But other than that, it does have some benefits to your health and your immune system. So raw garlic is very good. And you could put it in your chicken soup. Let's see. So now we're up to 8. If you have a high fever with the flu that lasts more than a day or two, antibiotics are necessary. Influenza is a virus, not a bacteria. So antibiotics are for bacteria, not viruses. Unless you have a complication that your doctor feels like you need some antibiotics, antibiotics don't help at all with viral influenza. And then 9, I can't get the flu vaccine because I'm pregnant. It's just the opposite. The Center for Disease Control is very strong in their encouragement that pregnant women, expectant mommies, get their vaccine, because expectant moms, pregnant women, can have greater complication than women in the reproductive years who are not pregnant. And also a wonderful benefit is to your unborn child, because if you get the vaccine, the baby has protection for several months. And remember, babies under 6 months of age cannot get the influenza vaccine, and they are at risk for complications because of their young age. Now, for pregnant women, you want to get the shot. You do not want to get the nasal spray, only the shot. And then lastly, number 10, I shouldn't get a flu shot if I have an egg allergy. Well, that's not the case necessarily. If you have a mild egg allergy, you can get the vaccine, and you just let the person knowing, whether it's the retail clinic or your doctor's office or the clinic, you make sure and tell them that you have a mild egg allergy so that they are aware and they follow protocol for giving you the shot and watching you for a little bit to make sure you're okay. There are a couple of vaccines that are without the egg protein, but those are only for people 18 and older. So I hope this information was helpful to you, and we'll see you on the next segment.